All right, Jade. So you're starting to tell me on the side a little bit about your experience with fibromyalgia
Yeah.
and how it has affected your mother.
Yes.
Can you just tell me a little bit about that?
Yeah. My mother got diagnosed with fibromyalgia maybe 3, 4 years ago, and nothing that they really offer or recommend has helped her. Right? They give you muscle relaxers that just makes her too drowsy. They recommend physical therapy. Sometimes it helps, and sometimes with action, like activity, she's exhausted, and it makes it worse. Some days it's good, some days it's bad, but the biggest issue is the exhaustion that that she'll get from doctor's appointments back and forth, no relief. It disturbs her sleep. That type of.
How many appointments did it take for your mother to get a diagnosis, an official diagnosis of fibromyalgia? And then at what point in her care did she start to get any kind of real relief or someone to acknowledge what she has?
I would say a very long time, like maybe more than a year, honestly,
Really?
because sometimes in this case, I mean, as we've looked into it, we see that people that have this issue with fibromyalgia, they can't even describe it at first. You go to the doctor and it doesn't, until you can really have a established case, right, over time, they can't make a justification to diagnose you with fibromyalgia. So she might say, oh, I'm having pain, and then they'll say, oh, they have to rule out all these, they may do blood tests, and then blood tests come back with nothing, and then they may muscle testing or go to physical therapy, and that comes back with nothing. And then, after a while, they'll say maybe it's arthritis, because she does have arthritis. And then
What kind?
she has arthritis in her hands. She has arthritis in her knees. Growing up, she used to get rheumatic fever a lot.
Really?
Yeah. So, and like all throughout my childhood, like at least once or twice a year or a couple times a year, she'd end up with this. And then she'd go and get treatment for it. And then now, many, many years later, she's diagnosed with the fibromyalgia. And her experience has been difficult because her medical is average, right? So for the most part, they'll recommend physical therapy and pain medication. And she doesn't always want to be in physical therapy every other day to get relief.
So she was diagnosed about a year and a half ago, officially with fibromyalgia.
Yeah.
But prior to that, she had to go to the doctor repeatedly with chronic pain.
Yes.
And they had to do a lot of ruling out
Right.
with extensive medical testing to even give her that diagnosis. But in the meantime, she was suffering all the time.
Right. And then people, and in her case even, they end up trying to self-medicate with like over-the-counter pain medication, and it does nothing. And then that in itself, long-term, has health effects. So she's concerned with that too. Like, she wants to be healthy. She doesn't want to be taking pain medication every day. So it's a process.
Now fibromyalgia, people experience that differently. Some, the weather affects them. A lot of times food is a big impact for them. Is your mom sensitive to any kind of food?
I mean, not
Sugar,
really. Not really.
carbs?
Not really. I mean, my mom, she's got similar build to me, and
Okay.
she's we don't eat the healthiest. We eat traditional food. A lot of meats, a lot of heavy foods and stuff. But she doesn't have any food allergies or anything like that. But she is asthmatic, and she's always been asthmatic. So asthma, allergies, it's along the same line. But for the most part, she's not going to be a vegetarian. I've tried. So, there's a.
The reason why I'm asking about the food, you may not show up on an allergy test to be allergic to food or food groups, but a lot of patients that I see that we see here in this clinic with fibromyalgia, a lot of them say that sugar, simple carbohydrates, greasy foods, unless they're eating very clean,
Right.
they have a lot of exacerbations, a lot of inflammation in their joints and those tender areas. I know you've been working with your mom a lot extensively, and you've done a lot of research on your own.
Yeah.
I think you were telling me about how maybe years ago you had to have a certain number of the 27 points of pain.
Right.
But I think you were saying it's changed a little bit now.
Yeah. From what I understand now, it's diffuse pain over 3 months. If they can have a historic, the 3 months to show the chronic pain for 3 months, just diffuse pain. It doesn't have to be any particular 18 out of the 20 some odd points. It's just diffuse pain. And then basically doctors and MDs are becoming more understanding or compassionate for people that have fibromyalgia, and they're able to get diagnosed a little easier than it was in the past, where in the past people even have considered to say, oh, it's all in your head, and that sometimes she ended up going to counseling as well, and still the pain persists. So it's not all in their head, and more it's becoming easier to get help for fibromyalgia.
That's really interesting to learn about the old prescription and the old understanding of fibromyalgia, which was 18 out of 27 points of pain. And you had to get some sort of psychiatric counseling to make sure this pain that you're feeling in your body wasn't believed to be in your head,
right?
Which is really a big dismissal of the patient, and they go untreated because of that. And fortunately, what you're saying now, it took a long time, but now it's generalized pain over the course of 3 months.
Right.
And now they believe it to be physically in your body and not to be totally mental.
Right, exactly. And that having them dismiss it and, oh, it's all in your head, that in itself compounds the issues people face with fibromyalgia. Then they end up frustrated, it disturbs their sleep, it exacerbates the pain, and they don't get relief. So it becomes like an ongoing circle of no answers a lot of times with fibromyalgia.
And frustration.
Right.
And the things with pain is that it really changes who the person is.
Right.
And this person doesn't want to be this way. Irritability with any pain, and especially chronic pain of any type, whether it's fibromyalgia or any sort of chronic pain, even if it's short-term acute pain, you'll notice that people are irritable.
Yeah.
They might have some anxiety, some depression. They might be going out of their way to not stay on their diet. So now their diet fluctuates and they pick some comfort foods. They might, accidentally self-medicate with certain substances like alcohol,
right,
or other alternatives to help with the pain, or not feeling mentally well because they're frustrated, depressed, and anxious, and now they can't sleep so well, and thoughts spiral out of control, and they don't know when this is going to end, and they have no answers from the medical community and their doctor.
Right. It's a whole process that without the right support, it can really become life-consuming. In my mom's case, she has me, she has 4 other kids, we are all there for her. But it can be a whole ordeal.
So besides being there to support your mother, it sounds like you're sometimes an advocate for her, seeing doctors, making sure she's asking the right questions,
right,
evaluating what kind of medication she's on, looking at her diet so much, giving her helpful tips. But you're also an acupuncturist, we're acupuncturists, we're holistic doctors in that regard. Have you done any treatments for her?
I have, and I find that she responds best to cupping because initially, just even the points were uncomfortable for her, but she responded better to cupping.
Really?
Yeah, and I feel that it's a gentle approach, but it can provide lasting relief in her case.
So cupping is that very famous therapy that was made famous by the Olympics and Michael Phelps when the Olympians came out with these dark purple black circles on their back. Now, I think you were telling me that that's like, extreme cupping.
Absolutely.
But there are many variations. So what kind of cupping would you do in the case of your mother who's very sensitive to it?
Right. Well, cupping is a great therapy because it can be applied gently. It doesn't have to be an intense, extreme experience where you're left with deep, dark bruising, and it can be done over a course of treatments. It's gentle, it's therapeutic and relaxing. That's the best part about it. She was able to receive relief in a way that she never experienced before because most people don't get to have the experience of cupping, but it's a gentle procedure, very gentle.
So you did it non-invasively.
Absolutely.
And you used low pressure instead.
Yes.
And maybe you added, instead of having 1 or 2 spots that were heavily pressurized, you'd use multiple spots at low pressure and non-invasively.
Exactly.
And then how soon did she receive benefit from that or decrease pain? Was it instant? Did it take a day or so? And how long did it last?
Honestly, after her first cupping experience, she said that it felt like a deep massage. It felt fantastic. And you don't have to use deep pressure for it to have that response. It's not uncommon immediately, but it doesn't always last right away. So regular treatments is the best approach in her case.
Right after cupping, did she feel a sensation of lightness in the area? Or was it heavy and achy?
I feel like if I remember correctly, her response was more that she just like her eyes felt like she could open her eyes, like so it's like
Yeah.
a pressure release, you know.
I understand.
Yeah,
Because people are so bogged down
right,
by the pain, and they're fatigued and tired from it. You're saying that she almost had like an energy lift,
right, exactly.
and now she had more
Like a
energy
weight
throughout the
lifted.
day. Yeah, so
Yeah,
weight lifted. Okay, that's really good to know with
yeah,
that.
yeah,
And how long did you say that lasted for her? I know it may take a series of treatments
yeah.
to have lasting effects.
But I would say like if she got a treatment like every 2 or 3 days, that was fine. And in other cases, it lasted longer, sometimes a week, sometimes more,
Okay.
and even longer at times. I feel like the more regular treatment she receives, the longer it lasts. And if it's not that there's flare ups, but if she has a flare up, she cupping is a great go to for us,
Right.
and she responds well to it.
Now that sounds like a lot of treatments in a week for the average person, but maybe it could be tailored for them that they can start off probably twice a week
Right.
for the first 2 to 3 weeks. And if they're responding very well, you can cut back to maybe once
Once
a
a
week.
week, yeah.
And during certain times when they're having a bad episode, they can
Right.
come in a little bit more frequently so they can get past that episode and get back to their life and not come in so much again.
Exactly.
Okay,
Yeah.
that's really good to know.
Yeah.
Well, I'm really happy that your mother is finding relief from cupping.
Thank you.
And cupping, acupuncture, Chinese medicine is very helpful for my fibromyalgia. And we'll come back and talk about this some more later.
So,
All right, Jade.
thanks.